Conflict and disease in South Sudan are putting a strain on the country's healthcare system, one of the weakest in the world, humanitarian actors warn. Escalating violence in Upper Nile State has displaced tens of thousands of people and is making access to medical care more difficult in rural areas.
South Sudan is experiencing a lot of challenges. Disease outbreaks, we have flooding, we have displacement, and now we have the clashes happening in Upper Nile. And all these are leading to increased needs, increased demand for medical activities and medical services. So it is not time to cut funding for South Sudan. We urge the donors and other international community agencies to come in and support South Sudan.
South Sudan is battling a cholera outbreak with 919 deaths out of almost 50,000 cases reported between September 2024 and April 2025. Health officials also warn of a rise in obstetric fistulas, a childbirth complication that can cause child and maternal death.
When you have cholera, it is pointing out there are things not going well. When you have fistula, it's pointing that there are things not going well. It points to so many things that are not going well, including stability. Because you may have health centers, you may have health workers, but when people aren't stable to reach those health centers, then they will end up developing fistula.
NGO Doctors Without Borders found that 2/3 of South Sudan's healthcare facilities were non-functional in 2023. The United Nations released an urgent aid of $10 million on Thursday to help vulnerable communities affected by the multiple crises in the country.